Do you guys ever think about how you're going to die? I mean, you do, don't you? I do. We all do that. I have this particular fantasy I've been fantasizing. I'm out cycling with my mate Steve. We've been cycling together since we were 20 years old. And he's had this habit, he's done this all the time. He just edges ahead of you. If you're a cyclist, this is called half-wheeling, so he's just pushing the pace up. It sort of annoys you after a while. So I get to this hill and I'm going, okay, this is over, once and for all. It's gone on for years, decades. So I leap up on the hill and I smash him. As I get just ahead, something goes terribly wrong and I'm dead before I hit the road. But Steve, he sees me faltering. He's like, oh, I can take this bloke. This is good. So he too sprints. And as he eases ahead and wins the last sprint, he too falls to the ground. He's stone cold dead. It's awesome. No one's had a chance to clip. We're like old wizened turtles on the side of the road because we're 92 years old. But what we've done, we've died a young man's death at an old age, and I call that living long and dropping dead. And that's what you're after, that, aren't you? Yeah, you like that because that's what we're all aspiring to. Except for the modern mantra is to not do that. It's to suffer a dozen or so years of serious disability before you die. So the modern mantra is to live long and die slowly. And my job in public health is to help us reach those aspirations of living long and dropping dead. Now, I think what we eat, that's got a fair bit to do with it, don't you think? Except for this isn't actually a talk about nutrition, sorry. It's a talk about how we know what to do to be well, who should hold that knowledge, and who you should trust. So this is a pretty nice place. This is the southernmost point of Vanuatu. They're really healthy here because they're living in a traditional lifestyle, as much they always have. So the World Health Organization knows this, of course. So they need to send an expert. So they appoint me to go to southern Vanuatu and advise them what to do in case things would go wrong, which is sort of weird, right? It's quite cool. You're in a Pacific paradise, it's lovely people, and I've got nothing to offer, so it's just really weird. Well, what are you going to do? Tell them to exercise more and eat less and eat low fat or something? Like, how's that going to end? So I just sort of hung out, took a few blood pressures, and quite possibly this will be the end of the contract. But one thing's immediately obvious to you, why you wouldn't want to interfere here, is it's a traditional society. That in these societies, I think, as have all traditional societies, they have a collective and deep knowledge about what it takes to be well. Interfering with the food pyramid, which is pretty much the tool you've got, and a bit more exercise, just seems wrong. You can step across to the other side of the Pacific. It looks all right on the surface, doesn't it? This is Tarawa, and it's part of Kiribati. It's a coral atoll in the North Pacific. It's just a couple of 100 metres wide, as you can see, and 40 kilometres long. But society's really become a bit more torn away from its traditional roots. There's 40,000 people living on this island. There's all sorts of experts coming in, like me. We need to sort this problem. If they'll listen to us, maybe it'll work out. I started with the diabetes team there. There's 10 people, and I tested them for diabetes to show them how to do it, and all 10 had diabetes. So we carried on to the community, and it's running at more than 50%, which, as far as I can tell, is the highest in the world. An island of 40,000 people, they're taking off between 10 and 20 people's limbs a month from the complications of type 2 diabetes. Just think about that. You know, that's a town the size of Wanganui or Gisborne. It's 400 every couple of years. It's a lot happening there. Again, we go in there and tell them to exercise more, eat less fat, especially saturated fat, and adopt these particular types of lifestyles, despite the fact it doesn't resemble anything that they've ever eaten when they were happy and healthy there. Something strange has happened, and I think it was inevitable really, and it happens here as well, that we're now relying on all manner of experts to tell us what to do, how to be healthy. And how did that happen? Well, I think the first part's obvious, right? Traditional society just disappeared. But then along came the scientific method, and that's a good tool, right? Because you can go, well, I've got this idea, I'll collect some data, then I'll discard, I'll chuck away the stuff's not true, I'll move on, I'll change my mind, I'll keep doing that. So I started over there, but I end up over here. But things got complicated in nutrition because it was hard. But more than it being hard, the information was only in selected places, medical school libraries, ivory towers. You had to be part of the club to know about this stuff. And when only a select few people knew and we wanted to know what we should do to eat, we needed to ask them. So the guys doing the science were also the guys giving the advice. And you've got a much more interesting situation emerging now. It's what Thomas Sowell, who's a political philosopher, and it was in that context, calls the vision of the anointed. So we've anointed the scientists as the experts. And that'd be great if they're always right, but we're not right in science. Half of what we know is wrong. We're still trying to figure out which half. We came up with this idea in the 60s and 70s, well, eating fat, that sort of looks like fat in your blood, and that probably makes you fat, and fat has a lot of calories. Maybe you should eat less, and it's a food pyramid, so we should avoid fat, especially saturated fat, and you've got to eat something, so we'll have a base of carbohydrates. So this is a diet, of course, that hasn't really looked like anything that humans have ever eaten for the entire time they've been on the planet, but what the hell, let's have a go. Well, that's fair enough, it's a hypothesis, and we can do that. And it is marginally more effective than the standard industrial food diet. But it's the least effective of a whole range of other approaches. And of course, my team's gone to the other end and said, well, hey, let's just flip that completely. How about you eat way more fat, and it's the sugars and the refined carbohydrates that are raising the fats in the blood, driving insulin up, which controls your fat storage. Maybe that's the problem. And it is more effective, especially for diabetes and weight management. And it's sort of, you're looking at this going, man, how did we get here? You know, we've run into this perverse situation where butter is a bit like marijuana. You know, most New Zealanders have tried it, but you wouldn't use it on a day-to-day basis. But then what, would you believe me? Because I've got the same problem. Half of what I know is wrong, and I don't know which half. I'm going to spend my career figuring that out. That's what happens in science. And if you put me in charge of telling everyone what to do, I too will be defeated by my own dissonance. I'll retreat into my own beliefs, not change my mind. That's humans. We do that. And I think the physicists understood this, right? Because Einstein knew that he'd eventually be wrong. Feynman described science as being a belief in the ignorance of experts. But even Max Planck lamented, guys, we might only be advancing one funeral at a time. So is there a way forward? We want good science, but someone else needs to translate it. I'd like you to meet George. George is an old rocker, as you can see. Cool glasses. Well, they were in 1981. When George came onto the scene, he broke into a medical warehouse, and then while on bail, a week later, he broke into a pharmacy because he was trying to find some compounds for some of his baking that he was doing at home. So he got 6 months in prison for that, at which time they also figured he had hepatitis C from 2 decades of intravenous drug use. And when he came out, he didn't sort it out then, he sort of carried on where he left off. So by the early 2000s, his health, he was almost dead from a combination of drug abuse and hepatitis C. This is his good thought, this is a really good thought. Like, I've been reading about biochemistry and physiology for 30 years now, pharmacology, I'm especially up on that. I'm going up to the medical school library to go and figure this out once and for all. There's got to be some solutions here. So off he goes, and he starts to read, and the internet's here, and other people are starting to write about this. He can communicate directly with the authors and other experts around the world. He starts to figure out some stuff. Thinks, maybe I'll try this way of eating. He does that, and his viral load drops by some 80%. To his amazement, his drug addiction of 30 years melts away. George starts to know a few things. He starts his own blog and starts to write about this, and he's involved in the discussion now. I ran into him last year. It's a Friday night. I've written this blog on some aspect of the science of nutrition. Some of my academic colleagues from the world have objected strongly to what I'm saying in the comments section. I don't really bother replying, but George does. And over the course of the weekend, there's some 10,000 words exchanged. And it's obvious to me when I read this, not only does he have the better of these people, but he's thought of several things that I never could have thought of. He's got some new insights. So I'm thinking, where's George? I've got to track this guy down. I think he's in New Zealand. And so he turns out to be on a benefit in West Auckland, and now he's employed as a research assistant in my centre at AUT University. He's a really valuable part of bringing a new perspective to that. And he is the hero here, actually, isn't he? He's the hero. But this is possible describes something new that's changing, a way that we can take back that wisdom away from just the experts about what makes us wise. What we need is a diversity of opinion and an independence of thought. In my field, public health nutrition, when you put your hand up and say butter, not margarine, that's contrary, and they'll smash you down. And that happens all the time. We need to move on. We need to embrace that. That's how science works. And we're going to need a way of bringing this all together, and that's here, folks, almost here. As George said to me a couple of weeks ago, 25 years ago, you'd have to know about a paper that had existed. You'd have to go to the medical school library, find it, copy it, go home and discuss it with yourself. Where was that going to end? Now, you're alerted by Twitter on your phone. You can download it for free. There's a full-text scientific paper on your own mobile. You can communicate with hundreds of people around the world of different opinions, including the original authors. It's changed. Now, we all don't have to become George. We don't have to all become experts, but you're invited. You're invited. And I've just been thinking a lot about public health. And it seems to me, if we're going to do public health, then just maybe we should engage the public. What do you think?